Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the anatomy of the trochlear nerve, also called cranial nerve number 4. And this is the only cranial nerve that exits the brainstem dorsally. This is the brainstem, and brainstem has the three parts: the midbrain, pons, and medulla oblongata. And the trochlear nerve comes out of the dorsal aspect of the midbrain just below the inferior colliculi. It innervates the contralateral superior oblique muscles of the eye. So this is the superior oblique muscle of the eye, and the superior oblique muscle depresses, intorts, and abducts the eye. So what are the effects of trochlear nerve lesion? If you want to know that part, that is, it, it its lesion leads to defective depression of the adducted eye, double vision or diplopia in attempting downward gaze when eye is adducted. Okay. So here we are looking at that. This is the trochlear nerve here. This emerges in the midline from the midbrain below the inferior colliculus. These are the inferior colliculus, one inferior colliculus here, another inferior colliculus here. Okay, so here is the trochlear nerve. Okay, emerges in the midline from the midbrain below the inferior colliculi. Another trochlear nerve is here, or the fourth cranial nerve. Trochlear nerve nuclei are small and are located dorsal to the medial longitudinal fasciculus. This is medial longitudinal fasciculus. This is the nucleus for the trochlear nerve, and this is small nuclei because from the trochlear nerve we will get only one muscle innervation, that is the superior oblique muscle. So medial longitudinal fasciculus is a fasciculus that connects the third cranial nerve, fourth cranial nerve, and sixth cranial nerve. Okay, and our trochlear nucleus also get connection to multiple sources from the cerebral cortex from the same side, cerebral cortex from the opposite side. It is connected to the medial longitudinal fasciculus. Also, it is connected to the inferior colliculus. Okay, we got that. And the trochlear nerve move around the periaqueductal gray matter, and it goes to the other side in the midline area like that. This is the periaqueductal gray matter, and the nerve is surrounding that, going out through the midbrain. Okay, partly it is present in the subarachnoid space. Then it goes to the lateral wall of the cavernous sinus, and it enters the orbit through the superior orbital fissure, and it innervates the superior oblique muscle. Okay, so the GAC, that is the general somatic efferent, not sensory. The trochlear nerve has no sensory innervation, it is a purely motor nerve. So this is the general somatic efferent fiber course dorsally around the lateral edge of the periaqueductal gray matter. This is the periaqueductal gray matter. They deposit above the aqueduct, exit the brainstem, passes through the lateral wall of the they pass through the lateral wall of the cavernous sinus, enters the orbit through the suborbital fissure. Okay, so we go to the trochlear nerve lesion. What are the features? What are the etiology or causes of trochlear nerve lesion? Most common cause is head injury or head trauma, vascular diseases like that of stroke in the midbrain or cerebrovascular accident in the midbrain area, diabetes mellitus in the elderly patient, cavernous sinus thrombosis, aneurysm, there is the abnormal dilatation of the internal carotid artery because internal carotid artery passes through the cavernous sinus. It may compress not only the trochlear nerve, it may compress that aneurysm or abnormal dilatation may compress other nerves too. There may be any orbital mass or tumor or abscess that may also compress the trochlear nerve. The trochlear nerve lesion may be unknown. Okay, so these are my references. Snell's Clinical Neuroanatomy, Fundamentals of Neuroscience. Okay, we got trochlear nerve. If you have any question, please feel free to ask me. Please share the information with your friends and please support my channel. Please subscribe me. Have a nice day. Bye now.